So again, welcome to Great Online Training. So today we're going to continue chapter 1, remaining guidelines. And the first point is methicillin-resistant Staphylococcus aureus, MRSA. What do you know about MRSA?
I don't know about this MRSA, but I know the Staphylococcus aureus is a bacterial infection.
Yes. It is related to infection only, as we are studying infection.
Yes.
It is something when pus form into the wound or something, not wound or any kind of cuts, scrapes or bites like that. So MRSA stands for methicillin-resistant Staphylococcus aureus. Please highlight this. The type of bacteria. Okay, they will ask you full form of MRSA.
Okay.
MRSA skin infection often develop around open sores like cuts, scrapes, or bites. But they also can affect intact skin. Red, swollen, painful bumps appear that sometimes ooze fluid or pus called an abscess. Some people also get a fever. Now we'll see coding guidelines for MRSA. Selection and sequencing of MRSA code. First, combination code for MRSA infection. When a patient is diagnosed with an infection that is due to methicillin-resistant Staphylococcus aureus, MRSA, and that infection has a combination code that includes the causal organism, for example, sepsis or pneumonia, like this. Assign the appropriate combination code for the condition. For example, code A41.02 is for sepsis due to MRSA or code J15.212 pneumonia due to MRSA. So we have combination code. You can see my screen.
Yes.
I have separate code for sepsis. You can see, okay, like this. So whenever you find any combination code, to use that combination code only. You should not code those conditions. Methicillin susceptible Staphylococcus aureus, okay, it is known as MSSA. You have two, MRSA also and MSSA also. MSSA means methicillin susceptible Staphylococcus aureus and MRSA means methicillin resistant Staphylococcus aureus. So MSSA and MRSA colonization. The condition or state of being colonized or carrying MSSA or MRSA is called colonization or carriage, while an individual person is described as colonized or being a carrier. Colonization means that MSSA or MRSA is present on or in the body without necessarily causing illness. A positive MRSA colonization test might be documented by the provider as MRSA screen positive or MRSA nasal swab positive. There are no such guidelines in MRSA, just we have to use combination code whenever it is available. So Zika virus, next Zika virus infection. Then see, virus is transmitted by its Aegypti mosquito, the same mosquito that transmits dengue and chikungunya. Its name comes from the Zika forest of Uganda, where the virus was first isolated in 1947. It can be transmitted through sexual interactions as well. In pregnant women, Zika can cause birth defects such as microcephaly. This is important. I think this is not included in book, right? So please write down in your book. Zika virus cause birth defects such as microcephaly. We get question on it. Usually small head and other brain abnormalities in babies. The infection can also cause Guillain-Barré syndrome, a rare neurological disorder that causes, and there is no treatment or vaccine for Zika virus infection. And symptoms include headache, conjunctivitis, fever, muscle pain, skin rash. Here in this, all this content, this is very important that Zika virus in pregnant women can cause a defect like microcephaly or Guillain-Barré syndrome. We'll get question in anatomy sections. So the first guideline, code only confirmed cases. This is example of microcephaly. This is normal head size. This is microcephaly. Head size is reduced. So code only confirm diagnosis of Zika virus. A Zika virus code is A92.5 Zika virus disease as documented by the provider. In this context, confirmation does not require documentation of any type of test performed. The provider's diagnostic statement that the condition is confirmed is sufficient. Okay. If the providers document suspected, possible, probable Zika, do not assign the code A92.5. Assign code explaining the reason for encounters such as fever, rash, or joint pain, or G20.821 contact with and suspected exposure to Zika virus. So whenever our provider confirm or says that Zika virus is there, Zika virus is disease or infection, in that case only we have to use A92.5 code. Otherwise, code go for symptoms like fever, rash, any symptom patient comes with. Or if suspected contact with Zika virus is there, we have to use G20.821. Next and most important part, COVID-19. What is COVID-19? Tell me something about
Coronavirus disease.
Okay, so coronavirus is a family of viruses that can cause illness such as common cold, severe acute respiratory syndrome, also known as SARS. That's why sometimes it's called as SARS coronavirus. SARS means severe acute respiratory syndrome.
Yes.
Please make note. Severe acute respiratory syndrome and Middle East respiratory syndrome. MRS. Middle East respiratory syndrome. Many people with COVID-19 have mild to moderate symptoms and can recover on their own. But COVID-19 can serious illness and lead to death in some people. People at higher risk include older adults and people with existing medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer. And getting COVID-19 vaccine helps prevent serious illness, the need for hospital care due to COVID-19, and death from COVID-19. So it is always better whenever for any disease, whenever any vaccine is available. So common signs symptoms of COVID-19 we all know. I'll explain. Uncommon symptoms like headache, loss of taste and smell, sore throat, skin rash, nausea, vomiting, chills, discolored extremities, and diarrhea. These are not uncommon symptoms. And severe and common symptoms are shortness of breath, difficulty breathing, coughing of blood, persistent chest pain and pressure, kidney failure.
Only repeat this.
Yes. So now we'll see guidelines for COVID-19. These are also very, very important guidelines like HIV and sepsis. Next important topic is COVID-19 in this chapter 1. So COVID-19 infection or infection due to SARS-CoV-2. First guideline, code only confirmed cases. Code only confirmed diagnosis of 2019 novel COVID-19. Okay. As documented by the provider or documentation of positive COVID-19 test result. For a confirmed diagnosis, assign code U07.1. U07.1 is code for COVID-19, confirmed COVID-19 cases. If the provider documents suspected, possible, probable, inconclusive, do not assign U07.1. Instead, code, sign and symptom. Next guideline, sequencing of codes. When COVID-19 meets the definition of principal diagnosis, code U07.1 COVID-19 should be sequenced first, followed by appropriate codes for associated manifestation, except when another guideline requires that certain codes be sequenced first, such as obstetrics, sepsis, or transplant complications. Okay. If the reason for encounter is COVID-19, we have to use U07.1 as a principal diagnosis. But along with COVID-19, if that patient is pregnant, or suppose that patient also has sepsis infection, in that case, sepsis get priority. Means we have to code use sepsis code as a principal diagnosis. Or in case of obstetric codes, as obstetric codes always takes priority over all the codes, we have to use O code as a principal diagnosis, followed by U07.1. Any doubt?
No, I'm clear.
Guideline. Acute respiratory manifestations of COVID-19. So these are a few manifestations of COVID-19. In case of brain, anosmia, headache, Guillain-Barré syndrome, myalgia, neuropathy, encephalitis, encephalopathy, like these things are there. In case of throat, cough, sore throat, and rhinorrhea. In case of heart failure, myocardial infarction, myocarditis, or arrhythmia is there. In case of kidney, acute kidney injuries are there. In case of vascular and systemic, we have fever, fatigue, cytokines storm, inflammation, lymphopenia, and coagulative disorders. And in case of skin, we have rash, urticaria, and dermatitis. In case of intestine, diarrhea and anorexia is there. In case of liver, alterations of transaminases. And in case of lungs, respiratory failure, ARDS, dyspnea, and interstitial pneumonia. These are manifestations of COVID-19, and we have separate coding guideline for acute respiratory in manifestations of COVID-19. When the reason for encounter is a respiratory manifestations of COVID-19, assign code U07.1 for COVID-19 as principal diagnosis. For respiratory manifestation, use additional. Okay, and for non-respiratory manifestations of COVID-19, when the reason for encounter is non-respiratory manifestations like viral enteritis or encephalitis or something other than lungs. Okay. Again, assign U07.1 as a principal diagnosis and additional code for other manifestations. Okay. So guideline is same for both, whether it is respiratory manifestation or non-respiratory manifestation. We have to use U07.1 as a principal diagnosis, followed by additional code for that particular manifestations. Exposure to COVID-19. You know how COVID-19 get exposed. We get exposed to COVID-19, right?
Yes.
Infected person spread droplets, and droplets, if we came in contact with those droplets, it may be due to indirect contact or direct contact with another person. So for asymptomatic individual with actual or suspected exposure to COVID-19, assign code Z20.822, contact with and suspected exposure to COVID-19. And for symptomatic individual with actual or suspected exposure to COVID-19 and infection has been ruled out or test results are inconclusive or unknown, code signs and symptoms and then code Z20.822. Okay. So what it says, if patient is asymptomatic means it has, that patient has no sign and symptoms, right? So you have only one choice of coding this code. We're using this code Z20.8. But if patient is symptomatic, you have two choices. You have to use those sign and symptoms first, followed by this code Z20.822. Same code. But if sign and symptoms are there related to COVID-19, we have to first code COVID-19 symptoms and then Z20.8. If that test results are inconclusive or unknown, in that case, if test result get positive, you have to use U07.1 code, right? Clear?
Yes, clear.
Next, screening for COVID-19. For screening for COVID-19, including pre-operative testing, whether it is testing for done before some procedure, means pre-operative, that is also included in this. Assign code Z11.5, encounter for screening for COVID-19. So see, we have two separate codes. For exposure to COVID-19, we have Z20.822, and for screening, we have Z11.52. Don't get confused between these two codes. signs and symptoms without definitive diagnosis of COVID-19. Yes. For patients presenting with any symptoms associated with COVID-19, but a definitive diagnosis has not been established, assign appropriate code for each presenting sign and symptom. If a patient with sign and symptoms associated with COVID-19 also has an actual or suspected contact with or exposure to COVID-19, assign Z 20.822 contact with and suspected exposure to COVID-19 as additional code. The same guideline. Asymptomatic individuals who test positive for COVID-19. Although the individual is asymptomatic, the individual has tested positive and is considered to have COVID-19 infection. Okay, so if test positive and symptoms are not there, in that case also you can code. If test positive, you can use U07.1 code. Next, personal history of COVID-19. So this is subsection of this guideline. Okay, a symptomatic individual who test positive for COVID-19. Personal history of COVID-19. For patient with history of COVID-19, assign code Z86.16, personal history of COVID-19. And follow-up visit after COVID-19 infection has resolved. For individuals who previously had COVID-19 without residual symptoms or conditions and are seen for follow-up evaluation and COVID-19 test results are negative, assign code Z09. Encounter for follow-up examination after completed treatment for condition other than malignant neoplasm. Okay, and additionally you have to use Z86.16 to indicate personal history of COVID-19. So in case of follow-up visit after COVID-19 infection has resolved, please pay attention here. After COVID-19 infection has resolved, there is no any sign and symptoms of COVID-19. All COVID-19 get resolved and this is the follow-up visit of the patient. In that case, you have to use Z09 as a principal diagnosis to indicate follow-up, and additionally we have to use Z86.16 to indicate personal history. Encounter for antibody testing. For an encounter for antibody testing that is not being performed to confirm a current COVID-19 infection, nor is a follow-up test after resolution of COVID-19, Z0184, encounter for antibody response examination. So we have separate code for encounter for antibody testing. Okay, we have separate code for follow-up examination. We have separate code for history of COVID-19. Again, we have separate code for what is preoperative testing or screening, right? And we have separate code for exposure. This is clear? COVID-19. Next, multisystem inflammatory syndrome. Symptoms of multisystem inflammatory syndrome. Fever that lasts more than 3 days. Vomiting, diarrhea, stomach pain, skin rash, redness or swelling of eyes, lips, tongue, hands and feet. Headache, dizziness, lightheadedness, sore throat, severe stomach pain, difficulty breathing, like this. For individual with multisystem inflammatory syndrome, MRSA, and COVID-19, assign code U07.1, COVID-19 as principal diagnosis, and M35.81 for MIS as an additional diagnosis. If both the conditions are present, you have to code COVID-19 as a principal diagnosis and MIS as an additional. If an individual with a history of COVID-19 develops MIS M35.81, multisystem inflammatory syndrome, and U09.9, post-COVID-19 condition unspecified. Okay, any doubt in this guideline?
No, it's clear.
So if COVID-19 infection plus MIS, both the conditions are there, U07.1 as a principal diagnosis followed by M35.81 for MIS. And if individual with history of COVID-19 develops MIS, because MIS is the manifestation of or cause due to COVID-19. Okay, that's why we have to use this code, U09.9. You should not use Z code to indicate, okay, because this is somewhat post effect of COVID-19. That's why we have to use post COVID-19 condition as the second. If an individual with a known or suspected exposure to COVID-19 and no recurrent COVID-19 infection or history of COVID-19 develops MIS, assigned M35.81 for MIS and G20.822 contact with and suspected exposure to COVID-19. Okay, so if MIS is there and suspected exposure to COVID-19 is there, and there is no any history of COVID-19 is there, or no current COVID-19 infection is there, in that case you have to use suspected exposure code as an additional code. This is very important guideline. If you have doubt, you can ask me.
No, it's clear.
Okay.
Yeah.
So they have given three scenarios. First scenario is related to current COVID-19 infection and MIS. In that case only you have to use COVID-19 as a principal diagnosis and code U07.1 as a principal diagnosis, followed by MIS code. And if MIS develop post COVID-19 or MIS with history of COVID-19 is there, we have to use MIS as a principal diagnosis and U09.9 post COVID-19 condition code as an additional. And if there is MIS is present but there is no current COVID-19 infection or history of COVID-19 is there, you have to use suspected exposure code as an additional. Additional code should be assigned for any associated complication of MS. Plus, apart from this, we have to use additional code for any associated complication of MS. Next, post-COVID-19 condition. For sequel of COVID-19 or associated symptoms or condition that develop following a previous COVID-19 infection, assign code for specific symptom or condition related to previous COVID-19 infection, if known, and use code U09.9 post-COVID-19 condition unspecified. Code U09.9 should not be assigned for manifestation of an active or current COVID-19 infection, because for current COVID-19 infection we have which code?
207.1.
Yes.
Current.
And for sequela we have U09.9. Remember this difference?
Yeah.
They can trick you in the options like this. Read your question carefully and select code. If a patient has a condition associated with previous COVID-19 infection and develops a new active or current COVID-19 infection, code U09.9 may be assigned in conjunction with U07.1 to identify that patient also has condition associated with previous COVID-19 infection. Means we can use both the code at the same time also, U09.9 and U09.1, because we may get infected with COVID-19 several times, right? It is not like that, like chickenpox and once we get infected, we will not get infected any other time in future, right? So that's why we can use both the code at the same time if required. If patient has condition associated with previous COVID-19 infection also and develop active COVID-19 infection, we can use both. Then under immunization of COVID-19 status, use code G20.310 unvaccinated for COVID-19 may be assigned when patient has not received COVID-19 vaccine of any type, and code G28.311 partially vaccinated for COVID-19 may be assigned when patient has been partially vaccinated for COVID. So we have separate code for unvaccinated people also and for partially vaccinated code. This is the table, important table of COVID-19. The term, if COVID-19 is there, positive diagnosis of COVID-19, we have to use U07.1 plus additional diagnosis should be used to report manifestation like MIS and all. If contact with and suspected exposure to COVID-19 is there, we have G20.822 code. If patient is symptomatic code sign and symptoms, and then use G20.820. And for asymptomatic patient, we have to directly use G20.8. For late effect of COVID-19 or post-COVID-19 condition unspecified. For current infection, okay. For first C, for late effect or post-COVID-19 condition, we have U09.9. And if with late effect of COVID-19 or post-COVID-19 condition, if current infection is also there, okay, current active COVID-19 infection is also there. In that case, first code current infection, current sign and symptoms, then add U09.9 as a secondary diagnosis. For personal history of COVID-19, Z86.16 code is there. For follow-up visit after COVID-19 has resolved without residual sign and symptoms or condition, we have G09 code. Encounter for antibody testing, we have G01.84. Screening for COVID-19, we have G11.52. For unvaccinated COVID-19, we have G28.310. And for partially vaccinated for COVID-19, G8.311 is there. Okay. You can note down these codes in your guideline section. There is no issue. At least.
Yes, I did. I did all that.
So that's it. Now last question and answer. So you have to give me answer. Now you know how to search the codes, right?
Yes.
A 19-year-old patient is diagnosed with viral meningitis. What is the appropriate ICD 10 code? I'll show you in here. In alphabetic
I got meningitis viral.
You have to search for viral.
Yes.
Following the first line, huh?
Viral N is A87.9.
Yes.
So when the section, you have to go to tablet section, is it?
Yeah, it is always better to know such guidelines, but to go and check. But see, right now, here, in this case, when you have options, okay, you got your correct option, right? So there is no...
87.9. Yes.
Your time right now. But whenever you go for your job, you are doing your medical coding job, in that case, you have to go and search for it. If you have no confirmation, okay?
Yes.
As right now here you have options and you get your correct answer here. So correct answer is A, 87B is the correct option. So next question. A patient presents for results of HIV testing which were negative. What is ICD code? You remember that table? There is no need to go and search for it.
Yes, I'm not searching. Yeah. B20 is the HIV test code. So
no, B20 is confirm.
Sorry?
B20 is confirm HIV code.
Yes, that's why I'm avoiding that one option. It is a confirmative. Z21, I think it's...
Read the question, girl. HIV testing is there, but results are negative.
Yeah. I remember the question, but I didn't know the answer.
Now, then go and search for it. As the patient here not presenting for testing, he present here just to inform that test results are negative. That's why we have to use the follow-up or consultation. This is 71.7. This is A option. When a patient has a blood test for HIV that is inconclusive. What is ICD?
HIV in R75?
Yeah, correct. This is very easy question as it consists, though it is blood test, it is inconclusive, we have R75.
R75.
T20 is for confirm HIV infection.
Yeah.
Then, so correct answer is D, R75. Next question, pneumonia due to adenovirus.
Pneumonia due to adenovirus. What? It's under this.
Go on the alphabetic index and search for
pneumonia.
Okay. Didn't get your code. Search from this starting.
Yeah. Yes.
Adenovirus, you will get at the starting.
Pneumonia. Yeah.
So very good. This is the correct answer. You will get the second term, pneumonia start. How many pages are there for pneumonia? So many pages.
We have pneumonia. We have 2 pages only.
2 pages. Yeah.
Yeah.
But as it starts with A, right? Adenovirus.
No. P only, yes.
Yeah. So this is the second term, right? After starting of.
Yeah.
So our correct answer is
J12.0.
option B, J12.0. Now, fifth question. A patient has a history of MRSA. She had just been diagnosed with pneumonia due to possible Staphylococcus aureus. What is ICD 10 code or codes are reported? First, read the question. First, try to.
Yeah.
Whenever you see more than one code, try to rule out the option and then go for search.
J18.9, B95.62.
What? I didn't get you.
Sorry.
I didn't get you. Whatever. Tell me.
Option D.
Option D.
Yeah. J18.9.
Is it the correct option? You mean to say it's the correct option?
Yes.
Why?
Is it correct?
That I don't know. You tell me why did you choose this option?
So, because the MRSA condition along with the other symptom, we have to toward the B95.62 follows.
Now read the question carefully. Again, you can solve this question just by eliminating the options. There is no need to go and search for codes. You want to try, or I explain? Okay, I'll explain because you are not able to identify exactly what type of code you will need. So you are not able to eliminate the option. That's why you asked again. Okay. So see here, the first thing, this is the history of MRSA. Okay. Patient has history of MRSA. This is not current MRSA. Okay. So we need history code for MRSA. History code starts with which we need Z code for MRSA. Okay. So look for the options which has Z code.
Okay.
For the options which has Z code and eliminate the other options. So we have A and C, which consists MRSA history. Okay. So here B and D get ruled out as this is history. That's why I'm saying read the question carefully.
Yeah.
You have to solve questions of 1 page long question also. So this is the practice starting phase. Okay. So history of MRSA, as we need code for history of MRSA, we have only two options here, A and C. And now we move forward to pneumonia. Just be diagnosed with pneumonia due to this is possible Staphylococcus aureus. They have given organism, but that is possible. Means pneumonia is confirmed, but that organism is not. Okay, pneumonia is confirmed, but causal organism is not confirmed. They said pneumonia due to possible Staphylococcus aureus. So we need.
Yeah.
We have to use. Now you can tell me pneumonia.
Answer is A.
What?
Answer is A.
Why A?
Not A.
Go and search for pneumonia.
Yeah, I'm searching.
We don't have any causal organism here. We need default code for it, which you will find right after pneumonia term.
J18.9. C answer is
yes.
J18.9 is the pneumonia. 86.14 is the possible staphylococcus.
So see, this is how you have to find out your answer. And actually, there is no need to go anywhere and search for your code. If you read the question carefully, you will understand that this is history of MRSA, means we need to indicate MRSA. So we rule out B and D here, okay, because of Z code. And after that, they have given pneumonia due to possible Staphylococcus aureus. So we need only default code for pneumonia, which is 18 That's why the answer C, the correct answer, J18.9 plus Z86.1. And if you want to search, I'll show you how to search this code also. Okay, because sometimes you will not able to eliminate like this. Maybe they will give you another option also of Z code. So I'll show you how to find the code for history of MRSA. Can you tell me how to find the code for history of MRSA? Suppose they have right now here they have given same code in the both the options. So no need, but if they change some digit in one code to confirm that, right?
Yes.
And history code is better to go and search because description sometimes in most of the cases description It's different.
Okay. So how to search the history of
You
mRNA?
tell me. I'll guide you.
I have seen in the mRNA paragraph which you told
Yeah,
now.
you can
That's
directly
why I
go
said
like
that.
that also. In the guideline section, you will get history code.
Yeah.
It is easy to find. And
Yeah, I have seen there only on G9 page history.
I'll show you that you maybe highlighted. You will get that code. And I'll show you how to search in the alphabetic index section.
Okay.
So go into the alphabetic index and search for age terms and history. Okay? Write down the steps and search afterwards. In the alphabetic index, if you go and search for history, remember it always starts with family history. Okay, as it
Mm-hmm.
comes before P, as these are arranged alphabetically, right? So it always starts with family history. Whenever you go and search for code, history code, any history code, we have two types of history, family history and personal history. And as these all are alphabetically arranged, okay, these terms are arranged alphabetically, it starts with F first, means F for family. Okay, after that you will get code for personal history. So don't get confused because all other other terms are similar. That's if you not able to miss this term, will come with follow
Yeah,
the
I
first
understood.
line and search for personal. Here is the personal. First, they have given codes for family history and then personal. Please search in your book right now
Yeah, I'm searching.
because this is little bit confusing.
Yeah, when your history and person. Under the personal, we have to go in.
Get same codes Z91 419, Z91 413.
Let me check.
Just tell me page number.
207.
07.
207.
50.
Oh, sorry, 206. Z86.14. I got it. 206.
This is family, this is family. Here, it starts with here. 205.
Yeah. But the answer is on 206.
Yeah, answer maybe another page.
Yeah.
So, on here, now you have to search for personal infection. So, the MRSA infection, right?
Infection. Yeah.
Now you have to search for infection.
Under the infection, we have MRSA.
Yes.
Here in the second column.
MRSA. This is how you have to search for history.
Okay.
Okay? We have SARS-CoV-2 also. For COVID-19 also, same code.
Yeah.
But just remember, whenever you search for history code, it starts with family history first.
Okay. Yeah. Here.
So I hope you have learned all these guidelines.
Here, how can we know that we have to search in the family history or in the personal history? How can we know that?
Right now, they have just mentioned in this question, patient has history of MRSA. This is personal history. If family history is there, they will mention it, document like that.
Okay.
Some disease or father, mother, or some relative's name is given like that. Okay.
Yeah. Okay. Got it.
You just have to search correct code. They may get treat you like in one option they will give you family history code. In one option they will give you personal history like that also. Okay.
Yeah. I got it.
So please try to search for different terms like this. Okay, so you get familiar with your book because practice is more important to clear the CPC.
Yeah.
So thank you for attention and thank you for attending this session. Take care.
Bye.